Hi friends, welcome back to my channel sharing simple knowledge. Today again with another Osce clinical skill station, which is nasogastric tube insertion. So let's see how we can perform it. It is a 12-minute station, and first of all I will uh, talk about the equipment which is essential for this performance. So personal protective equipment, clean tray, then or trolley you can take it, then adherent dressing tape, fine bore and fit compliant nasogastric tube, receiver, then lubricating jelly if required. Otherwise you can, some nasogastric tubes have a lubricated coating that's activated with water, so we can just dip in the water. Then warm water we are using for lubrication. Then CE marked indicator strips with a pH range of 0 to 6. Then 60 ml NFIT compatible syringe, then permanent marker pen or tape to mark the tube. That is optional. So we will see how we can perform it. As usual with all other clinical skills, first we have to do the hand gel, then assess the area for safety. We can verbalize, I am checking the area for safety and it is safe to approach. Then next step is introducing yourself. So hello, my name is dash and dash and I came to insert a nasogastric tube as advised by the doctor to give you nutrition for a short term period, usually 2 to 4 weeks. Is that okay? So we explained the procedure to the patient and we got the verbal consent from them. Then we will gel the hands and take a clean tray or trolley and verbalize it has been cleaned with the detergent wipes. Check all the items are in date and intact and place it on the trolley. Nowadays they prepare all equipment in a trolley and we have to ensure everything is available. Just only the things, no need to arrange. They will provide all the equipment which is needed for the procedure. Then next we can gel the hands because we are performing the procedure in the same room. So it's nearby, so we don't want to go and so we can gel hands and then we can explain to them. I will assist you to a semi upright position with the patient. Then we can ask them, are you comfortable now? Then we can inform them, I will insert the tube through one of your nostrils. So before that, I need to check whether your nostrils are patent. If for some, if there is any obstruction in one nostril and we are blocking with the nasogastric tube, the other nostril means it can cause respiratory distress. So we have to ensure always prior insertion, make sure the nostrils are patent. So for that, how we can make sure? We can ask them, can you please sniff each nostril with the other closed and please do the vice versa. We can tell like that. Then next we can tell them, I will be inserting the tube through the patent nostril. So verbalize which nostril you are choosing. You can tell them, so I am going to use the right nostril, like that we can tell. Then we should inform them, we will insert through your nostril by sliding backward and inwards along the floor of the nose to the nasopharynx. So we can ask them, is it clear for you? Can I proceed? So don't make in a hurry. Just give time for the patient to be comfortable and to adapt to this procedure. So next, what we can inform, while I insert, you will feel some discomfort. So you just raise your hand to signal me to stop. So that thing we can inform. Then another thing is that you need to start swallowing as the tube passes down. So like that we have to tell. Next thing is that we should inform them, I will also stop if there is any obstruction and try again in slightly different direction or use the other nostril. Next step is also, if you experience any coughing or breathing difficulty, I will immediately remove the tube. Then we can ask them, do you have any questions? Can I proceed now? And always ensure that there is a working oxygen and suction machine at the bedside. Then we can ask the assessor, can I please consider the oxygen and suction is working? Then they will tell it's working, like that. So then always ensure a receiver is to the reservoir to hand in case patient feels nausea or vomiting, they can use it. Then next we have to gel the hands and wear the apron and gloves. The next step is that, so until that we finish, so next we have to measure the length, the distance from the tube. So how we can do? Then we have to inform them, and I am going to measure the distance on the tube from the bridge of the nose to your earlobe plus the distance from the earlobe to the bottom of the sternum. Then we can put a mark with the marker, but that is optional. So otherwise you can measure maybe like 55 centimeter or 60 centimeter, like that. The next step is we have to lubricate approximately 15 to 20 centimeter of the tube with the warm water. Some tubes are already lubricated, so once you dip in the warm water, it will be activated. Then insert the proximal end of the tube into the nostril and slides backwards and inwards along the floor of the nose to the nasopharynx. Stops if encounters any obstruction and tries again in a slightly different direction or uses the other nostril. We have already explained these procedures to the patient prior, so it's clear for them. Then ask the patient to start swallowing if they are able to, as tube passes down nasopharynx into the esophagus. Then advance through the pharynx as patient swallows until the measured indicator on tube reaches the entrance of the nostril. Then secure the tube. We should make sure there is no signs of distress such as coughing or breathlessness when the tube should be removed. If there is anything, we should remove immediately. Then use some adherent dressing tape to secure the tube to nostril and cheek. Then aspirate a small amount of the stomach contents, 0.5 to 1 ml, using a 50 ml syringe, and confirm the tube position by using pH indicator strip and confirm the presence of acid. The pH should be equal to or less than 5.5. Then if the tube is with the stylet, we can remove it or the guide wire if present. Then cap the tube. Then dispose all the equipment in the clinical waste bin, including gloves and apron and gel hands, and that verbalization is also accepted. Then always ensure the patient feels comfortable post procedure. Then states the additional checks that may be undertaken to check the positioning before commencing feeding. That means if the pH is above 5.5, for some cases like the patient is on proton pump inhibitor, it can be higher. At that time we can just stop for like 30 minutes, so it will back to normal. Or still it's high, means we have to perform a chest x-ray and upper abdominal x-ray to confirm the position. This is all about the nasogastric tube insertion for Osce NMC Osce clinical skill station. Still you have any queries, you can comment below the comment box. And thank you for supporting me, and keep watching my channel for another informative videos. Thank you very much for supporting. Thank you.